Well, welcome again and to our listeners and viewers to another in our series of interviews with the experts. I'm Malcolm Bell, your studio host, and this is the second in a series of three-part series on adult congenital heart disease patients. And we've got the good fortune of having Dr. Jokhadar joining us again. And in our last podcast, which I hope you were able to listen to, and if you haven't, I really strongly recommend you go back and listen to that, where we discussed the increasing prevalence of patients with adult congenital heart disease and the shortfalls in terms of the number of people to look after them, and most importantly, to how to care for them in the hospital. And we covered pitfalls and challenges. Dr. Jokhadar is a member of our division of structural heart disease. He's a specialist in adult congenital heart disease, and he's also the medical director of our critical care cardiology unit. So, Maan, welcome back again.
Thank you, Dr. Bell.
And today we're going to be talking about the patient who has adult congenital heart disease who's been seen by their primary care provider, their physician, the nurse practitioner, PA, in the outpatient setting. And maybe I'm just going to ask you straight off, these patients, do all these patients, particularly if they haven't been followed by an adequate heart disease patient or clinic, do they need to be seen in such a clinic?
The short answer is probably yes. Many of these patients who've either had surgeries when they were younger or were followed by a pediatric cardiologist when they were younger are lost to follow up for one reason or another, whether because they don't need to follow up or whether because, things happen, life happens, and they're lost to follow up. I think at least once, if you're seeing a patient who was born with a heart condition, who's either had surgery, particularly if they had surgery, or if they haven't, they should at least get a one-time review with a congenital heart disease specialist to make sure the long-term plan of care is followed up. There are also things that may not have been known in the past when they were followed. So the short answer is, I think just a one-time at least review with a congenital heart disease specialist.
So, that may be very easy for the patient who's had ongoing problems and already, well connected on a ongoing basis, with their adult congenital heart disease specialist. But you're really making the point that someone who hasn't seemingly had any problems, but maybe that's one of the questions you should ask, just along with all the other questions you ask in primary care, just to be sure that they are connected. And if they haven't, I think what you're telling us, that they should at least seek that appointment or be referred for evaluation and be sure everything's as stable as they think it is. With that in mind, obviously in primary care, you're not working in a hospital. You may not be working near a major medical center. So are these adult congenital heart disease clinics, are there enough of them in the country? How would you identify that, particularly outside of a major city?
There's a severe shortage of congenital heart disease expertise in the U.S. That being said, there are clinics available. There are much more clinics available now than there were 10, 20 years ago. And the easiest way to access this information is there's a website with a directory, the ACHA heart.org. ACHAheart.org has a directory of all the different clinics with the contact information, and I would encourage any primary care provider to refer to their home center. And for some patients, it can be a great distance to travel, a big burden, from taking time away from work, financially, et cetera. But I do think it is an important thing, at least have a plan in place, and to make sure no one is blindsided by a problem that could have been prevented.
Common scenarios in primary care may be someone's coming in with a fever or some sort of nonspecific symptoms. And I imagine that you're going to then, just be reminding us that, if there is a history of adult congenital heart disease, perhaps, so first it's important to be aware of that, but then how do you take that information into then how you're addressing someone's symptoms? So let's say someone's coming in and they've had a fever overnight and got some nonspecific symptoms, maybe a cough or a cold. What advice would you give? What pitfalls need to be avoided? And anything else that should trigger perhaps a little bit more investigation or caution in the management of those patients?
First of all, this is a partnership. We love to partner with our local primary care physicians, and it's a two-way street. We all want the same thing, and that's what's best for our patients, and that can only occur with good teamwork and partnership. We make a point of making sure we send correspondence to every referring provider and to every primary care provider for our patients. So this is a partnership that is incredibly valued. To answer your question, sometimes if just someone is with a cold or bronchitis, that's all it is, a cold or bronchitis. However, sometimes because these patients are at increased of life-threatening complications such as endocarditis, there should be a lower threshold to get blood cultures for these patients, particularly if there's artificial material, and especially if there is an artificial valve, for example. So even a fever, the malaise, not feeling well, can be an early warning sign of something more sinister.
And then, well, maybe just stay on the topic of fever for a moment. And as we know, I think that antibiotics, at least historically, for just in general, have been overprescribed for people presenting with nonspecific fevers. Are the stakes higher in these patients with adult congenital heart disease? And if so,
I think so. In my experience, endocarditis is one of the leading causes of morbidity and mortality for our patients. And so I think it's okay to be paranoid, okay to call wolf, okay to get cultures but I think particularly if there's prosthetic material, I think there should be a very low threshold to check for endocarditis and to check a blood culture before prescribing antibiotics. Now, if someone has strep throat and they test positive for strep throat, then maybe that's all it is. If someone has a urinary tract infection and then maybe that's all it is. But if someone has the dwindles, unexplained weight loss, the common symptoms of endocarditis, then I would definitely be more cautious.
Okay. So that's antibiotics. Are there other drugs that may be frequently prescribed and dispensed in primary care that you and I might benefit from that may actually come with some additional risk or unexpected side effects in these patients?
The big offender is non-steroidal anti-inflammatories, which not just for congenital heart disease, anyone with a heart condition or kidney problem, one should be very, very careful and thoughtful about using non-steroidal anti-inflammatories. Decongestants can trigger arrhythmia and worsen blood pressure. And then watching out for drug interactions. Some of our patients are on antiarrhythmic medications, for example, sotalol that prolongs the QT. So one has to be very careful about prescribing, say, a Z-Pak when someone is on sotalol. But even fluoroquinolones in someone with an aortopathy. We know that fluoroquinolones can increase the risk of tendon rupture. And that same mechanism may be responsible for ruptured aorta in patients with aortopathy, big ascending aortic aneurysms, et cetera. So I think just being extra careful and thoughtful and being mindful of the history of congenital heart disease is important.
Yeah, and in your experience, and this is no criticism of the care in primary care, but what would be the most common missteps that you've seen that could have been managed in a different way that sort of ended up with a patient being really very, very sick, and recognizing that these are busy practices, it's people trying not to over-investigate. And you talked about it's okay to be paranoid, but how many times you're going to do a chest X-ray or even a CBC in someone who presents with some nonspecific symptoms. But in your experience, I mean, what are maybe let's say the top 2 or 3 symptoms that you've really just got to sort of take note of and really hone in, and then look for some additional help if needed?
3 symptoms primarily. Again, fever, malaise, symptoms of endocarditis, prescribing antibiotic before getting blood cultures. That's number 1. Number 2, non-steroidal anti-inflammatories. It can precipitate acute kidney injury, heart failure in these patients. And then the other pitfall is palpitations or panic attacks. Sometimes a lot of our patients are diagnosed with panic attacks when they're not panic attacks. They're arrhythmia, and it's the heart-brain interaction. When we are nervous, our heart may go fast, but when our heart goes fast, we may also get nervous. So it's the classic chicken or egg phenomenon. So those are the 3 main things I think to watch out for and to keep in mind.
Okay. Well, Maan, thank you so much. And a lot of this comes back to knowing that you've got someone that you can call and have identified. So maybe you could just repeat how our listeners can reach out and find out where the closest, the most appropriate care for these patients with adult congenital heart disease may be received.
The national directory is for the ACHA website, and that's the ACHA Heart, HEART, HEART.org, ACHAHeart.org. And there's a national directory.
So no spaces there, ACHAHeart.org. Okay.
Yes, sir.
Well, Maan, thank you so much for joining us again. We're going to get you back to talk about some more specific issues and diseases and post-operative states in these patients in the future. In the meanwhile, I'd like to thank all of our listeners and viewers again for joining us. I really hope that you found this valuable, and look forward to having you again join us. Thank you.
At Mayo Clinic, learning fuels world-class care. I'm Dr. Peter Noseworthy, Chair of the Division of Cardiac Electrophysiology. I hope you enjoyed today's episode, and I want to let you know about the full courses that we have available. Head over to cveducation.mayo.edu and explore our live and online programs, quick on-demand modules, and CME accredited masterclasses. Join the thousands of clinicians who have already turned their curiosity into expertise at cveducation.mayo.edu.